The mission of NPH, Nuestros Pequeños Hermanos, Spanish for Our Little Brothers and Sisters, and its American fundraising partner, Friends of the Orphans, is to provide homes for orphaned and abandoned children in Latin America and the Caribbean. NPH provides a loving and nurturing family for the children, who are not available for adoption, but instead grow up in the NPH homes in their own countries, with their NPH brothers and sisters. Along with providing loving and nurturing homes for its children, NPH also provides outreach services to the surrounding population.
The whole reason I'm here is because of NPH. And NPH's philosophy of being a good member of the community in which they live. And so they're here taking care of orphaned and abandoned and disadvantaged children. But they're not doing it in isolation. They know that there are surrounding people that live next to them that have needs that are just as poor and disadvantaged many times. And they're reaching out to help the people next to whom they live.
Working with NPH and Friends of the Orphans, Dr. Peter and Lulu Daly have constructed the Holy Family Surgery Center at the NPH Honduras home.
The reason they got involved in Honduras was that they started out helping us to build a home for the boys who have special needs. So it wasn't really medically related. And it wasn't after that Dr. Daly found out that we wanted to build a small surgery room just up at the clinic. It was a much small idea.
The hospitals that are intended to service the poor people, they're woefully underfunded and overwhelmed with the volume of services needed. Those people go to the city and enter a bottleneck that just doesn't have the availability for them to access the services. So building this facility outside of that bottleneck and trying to deliver the care in the communities in which they live, that's the key to improve their access.
Before the surgery center was built, NPH was able to offer its children and patients from the surrounding community general medical care, but could not provide many specialized services. Often, much-needed health care was simply not available.
I thought it was extremely important to build a first world or first class facility in this third world setting, principally because I was asked to try to deliver some first world care to this particular child, Angela Rapallo, who I met on my first trip down here, in a semi-truck trailer that was converted into an operating theater and was traveling around the countryside.
He would need tools, and he even went to a farmer and said, I need a chisel. And he got a chisel, and we were trying to figure out how to autoclave it and sterilize it. And we were sitting by the trailer, and it broke down. I couldn't even get the electricity to it.
The expectations of the patient I'm operating on is to have nothing less than a first world result, because they're dignified people just like everyone else in every other part of the world. And to deliver that kind of first world outcome, and where you really need the tools. This is it. We are here, and welcome to the Holy Family Surgery Center at the NPH Honduras site. It really is true with healthcare. If you don't have a sterile environment, if you don't have all the people behind you that are necessary to give a good result, the sterile processing person, the nursing care to take care of them, the building that has the appropriate lights and the appropriate materials. So to really give this population something that is less than what is expected by their standard as a dignified human being, equal to any other dignified human being in any other culture in the world, would be doing an injustice.
Now that the center has been built and supplied with generously donated equipment, we need your support to keep it running.
The endowment relates to what I envision this surgery center to do. All the models that I've seen have been outsiders, either from the US or Europe or wherever, that have set up a surgical facility, and then that surgical facility really only functions when other physicians from outside come in and do surgery for 2 weeks a year. I don't see that enables the infrastructure of healthcare in Honduras on an everyday basis to be improved.
There will be patients coming back that need something, and we don't want this facility to sit idle for 48 weeks a year when it can keep going.
Getting the surgery center funded just from the building itself is just a small part of the beginning. Now that it's here, we have a lot more to do. The part of supplying people interested in coming is easy. I have so many emails and phone numbers and contacts that want to do it. The shortage that exists is the funding, really. Buying the gauze sponges and paying for a service contract for the sterilizer and trying to find the right suppliers for different instruments that are needed at surgery and provide those. That's where the slowdown is.
It's a huge amount of money to just pay for the infrastructure to make that work. The screws, the plates, the anesthesia equipment, the anesthesia gases. Once we use them, they're consumed. We need to replenish those, and that just takes an awful lot of money.
So if I have yourself or a friend that understands the mission, they can simply make a donation to Friends of the Orphans and specify that it goes to the Honduras Surgery Center. All of the money goes to this surgery center project. 100% of it goes to the medical care to take care of these people. None of it goes to any kind of salary that I receive, since I receive none. We really don't have any salaried employees. It's all volunteer work.
The center will not only ensure access to medical services for the children at the home, but also improve the quality of the healthcare in their local community by providing Honduran surgeons with an opportunity to collaborate with visiting surgeons and train in the use of the center's equipment.
I want to see this surgery center functioning with an engaged Honduran medical community that can use it on an everyday basis and can have some ownership of it. And I know that the Honduran surgeons are interested in utilizing the equipment at our facility. My goal is to welcome those surgeons in so we can share our knowledge, and it fosters their talent and it keeps the talent in Honduras.
Additionally, the center offers the children invaluable educational and vocational opportunities.
We would like to see the kids from the ranch that are going to medical school, that are becoming nurses, physical therapists, occupational therapists, come and work here. It's just a sort of a domino effect. People will come, people will work, they can see how they can better their lives.
Marilyn Antonez came to live at NPH Honduras when he was 3 years old, brought to the home by his parents who could no longer care for him and his siblings. After many years of dedicated study and hard work, he has recently graduated from medical school and is now planning his surgical residency, with an eye towards running the surgery center at the home where he grew up.
I always think why I wanted to be a doctor, and yes, I made up a decision when I was very young, but now when I look back, I see 3 of my brothers died, and they were very young, and I think most of the reason for that was that we didn't have access to health.
He's been a godsend because he knows the NPH organization, he knows the medical politics of Honduras and its local communities, and he knows the mission that we're trying to accomplish, that we're trying to serve the indigent people of Honduras, in particular in this surrounding region.
And he also wants to give back to his family, which is NPH. He wants to give back any way he can.
Kids that grow up in an impoverished environment, they lose hope. They don't have a model or a mentor to see or a pathway to even visualize to try to get to another level of dignity and vocation and profession. And this provides that. NPH has this on their grounds, and they have brothers and sisters who have gone before them, and Merlin's a perfect example, is going before them to say, I'm going to be like Merlin. I know I can do it.
Supporters of NPH are always welcome to visit the NPH homes and see the difference their donations make.
I think the greatest thing is to see where your money goes, to see what you've done, and just to experience the love.
And I think it's a matter of getting people down here. Once they see the place and they see the ranch and they see the orphanage and they see the surgery center and the work that is being done down here, they'll understand how important it is and how much good it's doing.
Please join us in supporting the Surgery Center. help bring much-needed medical and surgical care to those who would otherwise have no option but to live with the burdens of disease and disability.
In the end, it goes always back to you really want to be of service to the one who need this kind of service, because otherwise they simply won't get it.
We need people to help us continue this vision and this dream. We need people out there to help.